Again, that's a really important question. And like I mentioned before, communicating risk is very, very difficult. And we know from qualitative work with participants, not just around screening, but around trial participation, that actually people interpret risk very differently. And we all know people in our lives, right, who always assume the worst will happen to them. So if you mention any possibility of risk, they'll think it will apply. It's a definite. And then equally, the other people who are sort of, happy-go-lucky, oh, this doesn't really apply, it'll never happen to me. And particularly actually with healthy volunteers or healthy participants, so people that we've invited into screening, they don't have symptoms, they feel fine. I suspect that the majority of them would hear about potential risks and brush them off and think, not going to happen to me. So there's a big issue about communication in a way that allows participants to distill, accept, and believe, and that's a world of work. In terms of overdiagnosis in screening, again, that's a very particular kind of element, because all of us who work in screening programs have had participants flagged through screening with a nodule, gone on for surgery, had the nodule resected, and it was benign, which for us as clinicians is bad. It's a failure. We've put the person through an unnecessary operation for something that would never have harmed them. But inevitably, that person is always very grateful, because they sort of say, you found something, you treated it, and it turned out not to be cancer. So it's a win all round. So, and there's a disconnect there, right? And that needs to be addressed, I think. I don't know how you do that. I think there's some complicated sort of mixed methods qualitative work to be done with people around that, because I think, the overriding message that comes back from participants is it was always better to know, at least it's out now and I know it wasn't anything to worry about. So we need to work on that. I don't know how, but we do.